Heart disease remains the leading cause of death in the U.S., yet many of its most serious conditions begin quietly, with symptoms that are easy to miss or misunderstand. Today, doctors are combining early detection with advanced, less invasive treatments to catch problems sooner and save more lives.
The general public should understand that heart and vascular diseases are generally preventable by having a healthy lifestyle coupled with regular screening that can decrease risk and detect disease early. Peripheral artery disease, or PAD, occurs when there's blockage in the arteries to the legs by cholesterol plaque formation in those arteries. This decreases the blood flow and can lead to symptoms like pain or discomfort, especially with exercise. Symptoms that occur with PAD are often attributed to other things like arthritis or normal aging.
Technology has been very exciting in the recent years in heart surgery because we've been able to streamline our techniques to offer less invasive procedures. Technologies such as imaging and surgical instruments allow not just more aesthetically appealing incisions, but a more accelerated return to baseline level activities, shorter hospital stays, and quicker recovery time.
In the heart of Minnesota, North Memorial Health is advancing a mission of accessible, life-saving cardiac care through early detection and innovative treatment. Their team is helping patients return to fuller, healthier lives.
At North Memorial Health, we offer screenings for patients who either have symptoms or might just have risk factors without symptoms. For example, if a patient were to have diabetes or a history of smoking or high blood pressure or high cholesterol or a family history of heart disease, those patients could benefit from screening that will detect the disease early and take charge of the symptoms on time.
For over a year, I had problems walking. Couldn't walk to the store. My friends I couldn't visit because if they had stairs, I couldn't walk up them. Everything the doctors had me go through, all these different people, clinics and everything bouncing around. After a while, it felt like nobody believed me that I was in pain. They thought it was my nerves, they thought it was this, they thought it was that. I ended up losing my home, everything I lost because my legs didn't work. My doctor finally brought me to North Memorial Health to meet Dr. Wobo for a PAD screening test. I had significant blockages. Right after surgery, I was able to walk. Right when I got out of the hospital, I was able to walk right then and there. And it's just a simple procedure. So simple to get done.
If a patient has chronic leg pain, I would recommend speaking with a primary provider to order a PAD screening test. We perform a test called an ankle brachial index, where we measure the blood flow in the arms, the legs, and the toes using a Doppler probe. If there is detection of decrease in blood flow, then the patient is informed and we usually go on to more detailed testing and treatment if needed.
I never thought I'd ever find myself in an ambulance. I was a runner. I ate healthy by choice, didn't have any health concerns. I was getting ready in the morning to go to a wedding shower, and I was showering and I went to put the shampoo in my hair and lather it, and I felt a sharp pain in my chest. My husband was downstairs and I called him to come up. Once we got to North Memorial Health, they determined that my descending aortic valve had ripped. I couldn't tell you how quickly I was in surgery. Dr. Stram saved my life.
I'm very proud to be part of the team at North Memorial Health. The quicker patients get into the operating room, the more likely they have of surviving. In Jill's case, the emergency department physician was very quick to diagnose correctly so that we could mobilize the operating room in advance. Really within a matter of minutes from Jill's diagnosis, she was back in the operating room getting surgery.
Almost immediately, I started physical therapy, and I came 3 times a week. Emotionally, the physical therapy is such a huge part of the healing process because they're like your cheerleaders. They remind you how much you're progressing because you don't always see it yourself, so they are able to give you concrete evidence. Listen to your body. Don't minimize it. It could very well be a matter of life and death.
Heart health isn't just about treatment. It's about listening to your body, acting early, and staying connected to care. To learn more about cardiovascular services and screening options, visit northmemorial.com/heart and take the next step toward protecting your heart.